Welcome to the Lord Fairfax Community College Online Nursing Information Session, and thank you for your interest in LFCC nursing programs. Please view the entire video, as information discussed on one slide may apply to more than one program. Information contained in this video is not meant to be all-inclusive. It is meant to be a starting point to answer many of the questions you may have. Nursing programs are extremely rigorous and require much commitment and dedication by the student. To begin, you will need to apply online to LFCC if you are not a current student. There is no fee, and the Student Success Office can assist you if necessary. Then you will need to complete your placement testing in one of the LFCC testing centers, and you do not need an appointment. Testing center information is available on the LFCC website, including hours, preparation for testing, and length of testing. If you have SAT or ACT scores within the past 2 years, you will not need to take placement tests if in math you scored at least 520 on the SAT or 22 on the ACT, or if in critical reading you scored at least 500 on the SAT or 21 on the ACT. If placement testing identifies that developmental courses are necessary, you will want to register for the English Fundamentals and Math Essentials courses that are required. If you have earned college credits at other institutions, including VCCS colleges, you will want to transfer those credits to LFCC as soon as possible by using the Transfer Credit Evaluation Request form, which is available online. Official sealed transcripts from the other institutions must be attached. However, unofficial transcripts from other VCCS colleges are acceptable. Nursing programs offered at LFCC include Nursing Assistant or Nurse Aide, Practical Nursing, the Traditional Associate Degree in Nursing, and the LPN to ADN Transition Associate Degree in Nursing option. All programs are approved and regulated by the Virginia Board of Nursing, the VBON. Nursing assistants or aides give direct patient care, assisting with bathing, eating, transferring, dressing, and other activities of daily living. They typically work in nursing homes, hospitals, home health, and assisted living facilities under the direction of LPNs and RNs. This program does not have a competitive application process. However, students must show proficiency in Math Essentials, MTEs 1 through 3, and must place into English 111. Students are accepted in fall and spring semesters, and the program is one 4-credit course. Students receive instruction in the classroom and the campus lab and clinical experience in the nursing home. Once the student successfully completes the course, he or she may apply to the state to take the National Nurse Aide Assessment Program exam to become certified. Currently, the Nurse Aide program is offered only at the Middletown campus. The Practical Nursing Certificate program is 3 semesters, beginning in fall semester with pinning at the end of the following summer semester. Practical nurses work primarily in long-term care and primary care. Employment in acute care hospitals varies by region. They provide bedside nursing, giving patient care, treatments, and medications. They often work under the supervision of a registered nurse. Practical nursing courses are sequential. They must be taken in order. Classroom instruction, campus lab, clinical hours in long-term care and primary care are required. A 2 to 3 week preceptorship during the final semester is also required. Once the Practical Nursing Certificate is awarded, the student is eligible to apply to the Virginia Board of Nursing to take the National Council Licensure Exam PN, the NCLEX PN. Admission requirements for the PN program are the following. The student must have a minimum GPA of 2.5 on the most recent credits earned. All credits from the most distant semester in the calculation will be used. Therefore, the calculation may be based on more than 12 credits. Applicants must place into English 111 and must show proficiency in MTEs 1 through 6. Placement requirements are the same for the ADN program. MTEs are 1 credit, 5-week developmental courses which are self-paced. As many as 3 may be taken per semester. Admission requirements must be completed by the time of application. Nursing applications are available online in early January and must be printed, completed, and submitted with all of the required documentation by the due date, which is usually late March. The application process is competitive, and the most qualified applicants are accepted. All accepted applicants must meet the minimum requirements. Applicants must take the LFCC A2 entrance test, which evaluates academic readiness. Math, reading comprehension, and critical thinking scores are used for the PN program. More information regarding the LFCC A2 is provided later in this video. The V-Bond requires a high school diploma or GED. Students must have earned a C or better in general high school biology and in algebra, or they must take the college equivalent. Bio 101 General Biology is the college biology equivalent. Credit for anatomy and physiology or microbiology will not meet this requirement. The algebra requirement may be met by showing proficiency in MTEs 1 through 6 through testing or course completion, by having credit for Math 120 or 126 and MTEs 4 through 6, or by having credit for MTH 158 college algebra or higher. The Associate Degree in Nursing (ADN) curriculum is 4 semesters and begins in fall semester. The program prepares students as entry-level RNs who may work in various settings including acute care, primary care, schools, industry, home health, and hospice. Registered nurses assess, plan, and direct patient care. ADN courses beginning with NUR are sequential. They must be taken in order. Classroom instruction, campus lab, and clinical hours that include med-surg, mental health, obstetrics, pediatrics, acute and primary care experiences are required. A 3 to 4 week preceptorship is scheduled during the final semester. Once the associate degree in nursing is awarded, the student is eligible to apply to the Virginia Board of Nursing to take the National Council Licensure Exam RN, the NCLEX RN. All ADN RNs are highly encouraged to pursue a Bachelor of Science in Nursing degree, a BSN. Some employers may require a BSN. LFCC has guaranteed admission agreements for RN to BSN programs with several colleges and universities. A link is provided for more information. These admission requirements are the same as those for the PN program. I emphasize that they must be completed by the time of submission of the nursing application. A high school diploma or GED is required. Students must have a C or better in general high school biology, high school chemistry, and algebra, or the college level equivalents. Bio 101 General Biology, Chemistry 101 General Chemistry, or Chemistry 111 College Chemistry. Some BSN programs have chemistry requirements, so look ahead to where you may want to pursue your BSN to see what that program requires. The algebra requirement may be met by showing proficiency in MTEs 1 through 6 through testing or course completion, by having credit for Math 120 or 126 and MTEs 4 through 6, or by having credit for Math 158 college algebra or higher. Nursing applications are available online in early January and must be printed, completed, and submitted with all of the required documentation by the due date, which is usually late March. The application process is competitive and the most qualified applicants are accepted. All accepted applicants must meet the minimum requirements. The LFCC A2 entrance exam is required for traditional ADN and PN applicants. The LFCC LPN to ADN entrance exam is required for the transition student. These entrance exams will be discussed later. Listed here are the general education courses required for the ADN curriculum. Students are advised to complete as many of these courses as possible before beginning the nursing curriculum to have more time to focus on the nursing courses. Bio 141, 142, Anatomy and Physiology, and 150, Microbiology, must have been taken within 8 years of the nursing application to be awarded credit towards the ADN degree. As a minimum, Bio 141 must be completed prior to application, and the student must be enrolled in Bio 142 at the time of the spring application. Credit for Bio 141 and 142 is an admission requirement. Students can substitute credit for NAS 161 and 162 for Bio 141 and 142, however, both must be taken in the same series. In other words, NAS 161 and Bio 142 would not be acceptable. If a student has a college degree, a course substitution can be done for the SDV course. Credit for both, not either or, Psych 231 and 232, will sub for Psych 230. The entire lifespan, birth to death, must be covered. The more general education courses a student has successfully completed, the more competitive he or she will be as an applicant. For the LPN Transition Program, admission requirements and general education courses are the same as the traditional track. Sciences must be completed within the 8-year time frame, and admission requirements must be completed at the time of application. General education credits must all be completed by the time of application, or the student must be enrolled in the course during the spring of application. If accepted, the acceptance is conditional based upon successful completion of current courses with a C or better. Selection criteria. Specific criteria are used in the selection process. Is the application complete? Has the HESI been taken and a copy of scores included with the application? Official sealed high school and previous college transcripts must be included with the nursing application. The exception is other VCCS colleges. An unofficial copy of a VCCS transcript is acceptable. Unofficial LFCC transcripts must also be included. It is recommended that students order 3 transcripts from other colleges, 1 to be evaluated for transfer credit by LFCC Admissions and Records as soon as possible, 1 to be included with the nursing application, and 1 for the students' records if they do not currently have a copy. Order 2 high school transcripts, 1 to be included with the nursing application, and 1 for the students' records. Are placement testing and any required developmental courses such as English Fundamentals and MTEs complete by the application due date? Is the student a resident of the LFCC service area, which includes the counties of Clark, Fauquier, Frederick, Page, Rappahannock, Shenandoah, and Warren, and the city of Winchester? Students in the LFCC service area are given priority, however, competitive students from outside the service area are accepted. The strength of the HESI score is important and must meet minimum requirements. Students who have current Virginia CNA licenses are awarded 2 points in the application process. Pre-admission testing. The HESI A2 sections administered are reading comprehension, math, and anatomy and physiology. A critical thinking assessment is also administered. Appointments must be scheduled online with the LFCC Testing Center. Usually this can be done starting in December or early January. Detailed instructions for scheduling and purchase are online. The cost for each HESI A2 attempt is approximately $44. Allow 4 hours to complete the testing session. The test may be taken twice during an application cycle. Attempts must be separated by 30 days. Initial tests are given in January and February only, and retakes are given in March only. Students must score at the 45th percentile or higher in each of the 3 separate sections, and the cumulative score must be at or above the 45th percentile. Actual scores correlating to the 45th percentile change annually when the test is renormed. Student score reports include percentiles. Study guide information is available on the LFCC Testing Center webpage. LPN transition students take the LPN to ADN entrance exam, which assesses PN nursing knowledge. The cost is approximately $49. PN NCLEX review texts may be used to prepare for the entrance exam. Appointments must be scheduled online with the LFCC Testing Center. Usually this can be done starting in December or early January. Detailed instructions for scheduling and purchase are online. The test may be taken twice during an application cycle. Attempts must be separated by 30 days. Initial tests are given in January and February only, and retakes are given in March only. Both the HESI A2 and the LPN to ADN entrance exam scores may be used for 2 application cycles. Keep in mind that required scores change annually when the publisher renorms the scores. The V-bond sets the number of program seats. These decisions are based on many factors, including the number of full-time faculty and adjunct faculty and the availability of clinical sites. If current nursing students are returning to repeat a course, the number of new students accepted must be reduced. Middletown campus has 64 ADN seats, Fauquier 20. Middletown has between 16 and 24 LPN transition seats, Fauquier 8. The PN program is at Middletown campus only and has 24 seats. Accepted students are offered conditional acceptance pending background check and drug screen, physical exam, and successful completion of spring semester courses such as Bio 142 for traditional and ADN students or other general education courses for LPN transition students. Information regarding background checks, drug screens, and physical exams is included in new student packets and is discussed at orientation. It is the student's responsibility to make sure their application is complete, including required documentation or copies. Students may email questions to healthprofessions@lfcc.edu. No applications are considered after the posted deadline. Applications must be mailed or hand-delivered to the nursing office at the Middletown campus. No applications will be accepted at other LFCC sites. When the application becomes available online in early January, print it out and complete all information legibly. ADN and PN applicants may indicate their first, second, and third choices of program by location. LPN transition students may indicate a first and second choice. If an applicant makes no second or third choice, his or her application will be considered for the first choice only. Once a student is accepted, numerous things need to be done. The student must return the form accepting the offer of admission. A background search and drug screen must be completed. A physical exam form and any required immunizations must be completed. The student must be American Heart Association BCLS certified. Other programs like Red Cross are not accepted by clinical agencies. Lab packs must be ordered and professional liability insurance must be obtained. Information regarding these requirements is provided in an acceptance packet and at orientation. Orientation is usually held in May or early June. There is an HESI NCLEX preparation fee required at the beginning of each semester. Orientation for LPN transition students is held in May as their classes start with summer semester. Students will register for NUR 115 for their first semester. Clinicals are included in NUR 115, therefore, students are required to order LFCC nursing student uniforms. LPN transition students must obtain professional liability insurance to cover them as an RN student. This is different than their LPN liability insurance. Here are a few questions students frequently ask. When will I know if I'm accepted? Applicants are usually notified the first week in May. Do I need recommendations? Personal or professional recommendations are neither required nor considered. How much does nursing school cost? An estimate of fees and expenses is available on the LFCC nursing webpage under the Admission Process button. Should I work while in nursing school? Students should evaluate the number of hours they may need to work and determine if they have enough time for classes, clinicals, lab, and study. Few students who try to work full-time are usually successful in a nursing program. Here's a question for you. Do you have sufficient support of family, friends, and significant others to successfully complete the program? Write down and bring other questions to your advising appointment. Refer to contact information for advising appointments on this webpage. At the conclusion of this video, please print the Nursing Information Session verification form and take it to your advising appointment. All students are highly encouraged to meet with an academic advisor. Again, thank you for your interest in LFCC nursing programs, and we hope you have found the information in this video helpful.